A new study says more Albertans are waiting for important healthcare services even after the pressure of the pandemic has eased. While wait times for surgeries, scans, and specialists is well documented, this study says more and more people are waiting for those appointments. As Stephanie Thomas reports, some Albertans are willing to pay to be seen. Others say they just feel left behind.
Mary Jane Faubert could hardly walk. Multiple doctors told her she needed a knee replacement, but to book at an Edmonton hospital was going to take over a year.
It takes you a year because you have to get an x-ray, then you get in line for an MRI, then you see a surgeon, and then you try the other things, you try the cortisone shots.
So she went to Toronto on July 22nd and paid $30,000 out of pocket, not including travel expenses.
The type of service I got was exceptional. But shouldn't all healthcare be exceptional, no matter if you pay for it?
She's not counting on Alberta Health Services for reimbursement. Ashley and Alex Nikolova say each of their separate health concerns have been dismissed or involved long waits. Most urgently, Alex has a 1.5 year wait for a gynecologist after a negative experience in the emergency department last July.
That's insane, because by that time the problem could, increase into a larger concern or worse symptoms.
We left feeling defeated, and I was so worried about my wife because at that point she was still bleeding profusely. We were a number that they were trying to usher out the door.
These Albertans are not alone, according to a public policy think tank. Through Freedom of Information requests and provincial postings, secondstreet.org found that more Albertans are waiting. Since 2022, 6,000 more Albertans are waiting for surgery, 70,000 more are wanting diagnostic imaging. The total for Canadians on a wait list is about 3.7 million, but a spokesperson says the patchwork of data collected could make it closer to 5.8 million.
Really, the big takeaway is just that these numbers everywhere are far too high, and that we really need to get started on some serious health reform.
In an emailed statement to CTV News, the Ministry for Hospital and Surgical Health Services says Alberta's government knows there is more work to do to reduce wait times across our healthcare system, adding, "We need to do more."